The University of Hawaii at Manoa will give you the tools to follow your dreams, to create change and cultivate growth, to transform through innovative research, making a difference locally and globally. Eia ke kahua, it starts here. Go to takemetomanoa.org today. The University of Hawaii at Manoa will give you the tools to follow your dreams, to create change and cultivate growth, to transform through innovative research, making a difference locally and globally. Eia ke kahua, it starts here. Go to takemetomanoa.org today. The University of Hawaii at Manoa will give you the tools to follow your dreams, to create change and cultivate growth, to transform through innovative research, making a difference locally and globally. Eia ke kahua, it starts here. Go to takemetomanoa.org today.
Hi, everyone. Thanks so much for joining us. We're coming to you live from UH Manoa, and we're here to talk about the fall semester. I'm Marcia Mane. I will be the moderator, and we really want to thank those of you who've already submitted questions. We've gotten so many on a wide range of topics. Here to answer your questions this afternoon are Provost Michael Bruno, UH Manoa, and also Dr. Lee Buen-Consejo Lam. She's the Associate Dean of the John A. Burns School of Medicine, JABSOM, and she's also the liaison to the Hawaii Emergency Management Agency for the COVID-19 response. Thank you so much to both of you folks for being here. I know you are so busy, but we really appreciate you taking the time to answer all these questions. And they're going to be here for the next 2 hours. It's not too late to send in a question, so if you have a question, email eforum@hawaii.edu. That's EFORUM@hawaii.edu. And we're limiting this to students, faculty, and staff, so please make sure that you use your hawaii.edu email account. We've got a lot of questions to get to, but first, some opening remarks.
Thank you, Melissa. And aloha, kapa. I want to say a few words before we start. As Marissa said, we're taking the time today to update the campus on our preparations for the fall semester. And we're going to do that by answering questions submitted by our faculty, staff, and students. And that brings me to the only thing that I really want to say before we get started. I want to say thank you. Thank you for your hard work, dedication, and creativity as we navigated the past 18 months and as we set about preparing for the fall semester. And thank you for your patience as we have continuously adjusted the ways in which we work and learn. I took a long walk around campus early this morning, and it is full of life, with our students engaged in all of their orientation activities, meeting one another, and reminding us all of why we do what we do and what we're here for. So again, thank you.
Thank you, Michael. And we have so many questions, and really no surprise, the topic that is top of mind and that we had a lot of questions on has to do with COVID and vaccinations. And let's get on right into our first question. So This is for you, Michael. Will the university be providing free on-site testing services for any member of the UH Manoa community? And that includes faculty, staff, student, or departmental visitor.
The answer is yes. We will be providing free testing for all of our employees and students. An announcement just came out just a few hours ago, providing the details of the first phase of this program, which really is through an arrangement with the clinical labs of Hawaii. So please, for all those concerned, all those who are seeking testing, please take a look at that email. It provides details of the testing, but also the locations where one can go to get a test. Additional details will be coming out as we expand this program, which is likely to include testing opportunities on the campus. I do also want to note that we will have a free testing environment set up on campus on Saturday, this coming Saturday, from 8 a.m. until noon. And I'm told that there are 500 tests that will be made available. And those tests will be free of charge.
Great, thank you. And then this next question is for you, Lee. Can you elaborate the reasoning behind making the unvaccinated get tested weekly and not requiring the same of vaccinated?
Thank you, Marissa. That's a really good question. I know that all of us are very concerned about the Delta variant and how contagious it is. And certainly we hear about breakthrough infections and those that are vaccinated. And so I fully understand where the question is coming from. The reality is, though, based on the data, both here at the state level and across the globe, is that the unvaccinated population actually remains the most at risk for getting the Delta variant. And even more so if they don't wear their masks whenever they're not alone. So when we talk about wearing your mask everywhere indoors, unless you're isolated, what that means is really, if you are alone in a room, you do not need to wear a mask. But here in this room, there is more than one person, right? So we're all wearing our masks. And also it's important to wear the mask outdoors if we're in groups that we have a lot of people from different households or in crowded spaces. So the current surge is really driven primarily by the unvaccinated based on all the cluster and the contact tracing information. And so yes, while the R naught, which is the rate of spread, and we've seen lots of news about it, right? The original virus could be spread if you got it maybe to 2 to 3 people, and now we could spread it to 5 to 8 people, and so on and so on. But the more likelihood of the positive tests are going to be in the unvaccinated. And so given the logistics of the testing, and it really is primarily the logistics, then weekly testing of the unvaccinated is more likely to result in a positive test than doing weekly testing for the fully vaccinated. However, as new evidence emerges and we're still continuing in our search, this may change. But for now, that's the rationale.
And before we go to our next question, if you folks have been collaborating pretty much daily, right, over the past year and a half, you can kind of talk about that and some of the decisions you've made out of your conversations that, are keeping the campus, the community safe.
That's a really good point, Marissa. It's always dangerous if you pick on certain people to thank, and you always run the risk of not thanking others that you really need to include. And I will say that back in April of last year, April of 2020, we formed 8 working teams, each with a specialized area of expertise and interest, and each dedicated to a single goal, whether it was student learning, facilities, communication, our student residence halls, and we had a health and wellness team. And that health and wellness team has worked for so many months, more than 18 months now. I would say meeting at least once a week for all those many months, with the sole purpose of helping to guide this campus safely through the pandemic. And I have to say, Dr. Lee, when Consejo Lum, has been a leader on that team, on the team was mentioned earlier on behalf of the state of Hawaii and so many other areas. So I give special thanks to Lee and to her colleagues on that committee. They really, really deserve a lot of praise for what they've done and accomplished throughout this pandemic.
The university is definitely lucky to have you, Lee. Maybe if you could just weigh in what it's been like for you, and you're a medical doctor, and what this whole experience has been like for you.
Yeah, so I think we really look at it as an opportunity, and we're just really thankful that Jackson has been, invited to be a partner with the Department of Health and with HAIMA. And so we've had representation not only from the medical school, but really from the UH system level with Dr. Amy Grace and the School of Nursing with Dr. Chris Qureshi and the College of Pharmacy in Hilo, Dr. Carolyn Moss. So really a lot of us, Dr. Whitby, and there's so many people at UH that have been involved from the very beginning. And so not just with the health, but thinking about the IT, the data, all the modeling. Oh my gosh, I mean, that's really coming out of UH. And so we've been really happy to contribute and to be called upon to help serve the community. And yet it hasn't been easy, but it also hasn't been easy for, the physicians that are in the hospitals and the nurses and the housekeeping staff and everybody. And I think that's what, there's so much concern for the whole population, but what folks are not seeing are really the struggles that are being seen in the hospitals right now. And so that's why it's just so important that we all do our part, to keep us safe, because we really don't want to become those horror stories, that we're hearing in some other states. A quick close.
Excellent point. And the next question is for you, Lee. So why are we doing once a week testing and not twice a week testing?
Yeah, good question. So Oahu is in an area of high transmission. Actually, the whole state is. But the good news and the balancing factor is that, we're pretty confident that UH as a community has high vaccination rates and definitely higher than the general population, based on the best available data that we have. And so for now, the weekly testing with the PCR test is appropriate. And again, we're targeting it, towards those unvaccinated. And the key to remember is for those of us like myself who are vaccinated and, who may have a little bit of waning immunity, and we'll talk about boosters in a little bit. But as long as I keep my mask on, and everybody else keeps the mask on, we're gonna be safe together. And I think that's what people are forgetting. So when you think about all the data on the transmission, it's happening when the masks are off. So.
And this next question is also for you. What is the danger to students and younger staff members of remaining unvaccinated?
Sure. I think now, we're seeing that there, in fact, are real risks. Early in the pandemic, right, we were mostly seeing it in older patients or older populations. And so there was a lot of, if I get sick, it's like a little cold or a little flu, no big deal. Well, unfortunately, today, the headline across the country is that the hospitalizations are the highest to age 30 to 39 and in the under 18 group. And we're certainly seeing that here in Hawaii. And the reason is because these are the groups that have less vaccination compared to the 65 and older. These younger people, some without risk factors, are also getting long COVID. And what that means in real time is, impact on thinking and functioning and the energy to do your normal activities. And so folks, even if they're not hospitalized, they're getting some long COVID symptoms that can impair their ability to learn and work. And that's critically important, to a young person and to people who are of the working age. And then additionally, besides their own risk, they're really putting others who may be in their households, even others who may be fully vaccinated but compromised, they're putting them at risk by remaining unvaccinated.
Yeah, really got to think about others. Right. For sure. Michael, so this next question is for you. How can I tell if the students attending my class should be allowed on campus?
We are relying primarily on the Lumicite UH app, which I'm sure by now everybody watching is familiar with. The app will provide a green light on the student's phone once they have uploaded either their proof of vaccination or, I'm told as of this weekend, the proof of a negative COVID-19 test, as well as, importantly, done their daily check-in. Regardless of whether you're vaccinated or tested, you're still going to have to go through that check-in. It's a really good reminder that we need to self-assess. I do want to tell everyone watching that we are also working on a centralized system that will connect Banner and Lumicite and will inform the instructor in a way that preserves privacy, but only to the instructor, that hopefully the students in their class have been cleared by either having a vaccination or a negative COVID test within the last 7 days. This link is still a work in progress. And so, it might take another week or a couple of weeks to have that in place, but that's what we're aiming to do to make things simpler for the faculty and the students, frankly. So in some cases, we know, for example, a student may not have a smartphone and therefore may not have access to the Lumicite app. I do want to say to those students and to our faculty, if you have that situation, it is okay for you to look at a paper version of a vaccination record, the vaccination card, or a paper record of a negative COVID test. Finally, I want to say that any student that is not in conformance with these restrictions will be asked to leave the classroom.
And then once they leave the classroom, what is the next step?
The next step is that we expect that student, because the student is here to learn, that student will go ahead and if they need to, get a COVID test that will hopefully be negative and allow them to come back to campus. Ultimately, we would prefer that student, like everybody else, get vaccinated.
Along those lines, another question, in a scenario where a student refuses to wear a mask and comply with the mask mandate inside the classroom, what should the faculty do?
As little patience as we will have for not being vaccinated or being tested, we will have even less patience for anyone who refuses to wear a mask indoors. Such a person is not welcome on this campus, and that includes visitors. Any visitor, guest, student, or employee who is not wearing a mask indoors will be asked to leave campus. If they refuse to leave campus, we will inform DPS, our Department of Public Safety, and an officer will escort that person off of campus, and that person will be told coming back to campus will constitute trespassing.
It's a serious offense, right?
We are talking about the health and safety of our entire community, not just one individual. And there will be no exceptions made, in particular to the mask policy.
Okay, someone says if I'm vaccinated and I uploaded my card, do I still need to check in with the Lumicite UH app?
Do I still ask the question again?
If I'm vaccinated and uploaded my card, do I still need to check in
Oh,
with the
yes.
Lumicite UH app?
Yes, every person, whether vaccinated or having a negative COVID test, has to do their daily check-in on the Lumicite app. As I said earlier, even I find it very helpful to take a look at all of those questions that one has to look at, and you hit that yes or no button. That is the last stage of what we want people to do. Just do that self-assessment and verify to yourself and to us that it's safe for you to come to campus.
You know, we've heard in the news about some people creating fake vaccination cards. So what kind of penalties are there for individuals who upload a fake vaccination card or certificate?
You know, I know that this is now up on the Loomis site. It is also, if you go to the Hawaii Safe Travel site, you have a reminder in both locations. It is a violation of federal law and state law to in any way fabricate or forge a proof of vaccination. It's a very serious offense. We just learned a week ago that 2 visitors were arrested here in Hawaii for having false COVID-19 vaccination cards. So for anyone listening, don't even try it.
Yeah, that message for sure. Don't even think about it, right?
Yeah, I should also add, Marissa, that I don't think that many know this, and they might be surprised at this because it's extraordinarily time consuming. But our team is one by one examining every single proof of vaccination that is being loaded up onto the Loomis site. Every single one. They're looking at the photo of the vaccine card and the other information that you have to put in there. And if it doesn't look right, they are rejecting it. And then normally there is a back and forth with the person. But I want to tell people that we are, and again, at great cost and a lot of hard work by some really dedicated folks working with IT. They are examining all of those proofs of vaccination.
It's that important. Turning now to Lee, here's a question. Can I wear a face shield? What are approved face protections?
Great question. So the important thing to know is that face shields by themselves, so face shields without a mask, are not protective against the SARS-CoV-2 virus. What the face shields are helpful for is if someone directly coughs or sneezes into your face. But if you've seen a face shield, and especially if it doesn't fully wrap around your face, you're still exposed, right? And the virus comes into the mucous membranes, and so that's your eyes, your nose, and your mouth. And so that's why wearing a mask that has ideally a wire band, or a wire thing on the nose that has a good seal is really important. At least 2 pieces, ideally 3 pieces of fabric, or like mine has a filter in it, right? So those are the best type of masks. Definitely something that you cannot see through when you hold it up to a light. However, folks are more than welcome to wear their own eye protection in addition to a mask. And so safe eye protection is what we wear in the hospitals and the clinical settings. And so if it's a face shield, it should wrap around the face and ideally come down to here, or at least extend over the mask. Or eye goggles, but that are fully sealed. And so the typical safety glasses that you might pick up at a hardware store, those are open. And so you really need to have a sealed goggle. Now, some people worry about fogging and other things. So there are goggles that have indirect vents, meaning that it's closed. And so air can, when you breathe, it can come out, but stuff can't come in. And so either a sealed goggle with no vent or a goggle with an indirect vent plus a mask will keep you very, very safe. Again, that's what we've been using in the clinical settings for 1.5 years.
This other question for you, Lee, are masks required outdoors on campus? And, we got football season coming up. What about during football games?
Sure. So definitely, again, all of Hawaii is in a state of high community transmission. And so therefore, outdoors is recommended to wear a mask if you're in crowds and or safe distancing cannot be assured. So the question comes up, well, I'm with my group of friends, right? But maybe you're meeting another friend from someplace that you haven't seen in a long time. You don't know, right? And there's so much widespread transmission. So it's definitely safer. Again, if you're in a crowd or where you can't have safe distancing, the question comes up a lot about, well, what about I'm eating, right? I'm eating outdoors on campus. So eating outdoors is definitely better. than eating indoors. We don't want anybody to eat indoors together. But space out as much as you can. And when you're done eating, please put your mask on and you can talk story to your heart's content once you're done eating. And definitely in big crowds like football games, absolutely, please wear your mask.
Okay, thanks so much, Lee. This next question for you, Michael. Do UH Manoa units have any access to Lumicite data reports to verify compliance for check-ins and uploads of vaccine cards and testing results?
So the actual cards, the information about vaccination is protected information. Our IT department, that team is very familiar with and experienced in working with protected and personal information. And so at that layer, it resides, the information resides within our central system here, and it is protected. This is why we're going through the Lumicite app, and that app will provide a green all clear on the app. I think I said earlier green light. I don't know what I was saying. No, there's no green light, but the screen will show in green colors the all clear for that individual. So there's no need to share any information beyond that. So that's why the system was designed the way it was. Having said that, IT can run and will be running information reports at a campus level, so at a global level. And actually, they've been providing that to us over the last few days. Information like how many vaccination cards have been uploaded on the system, how many came from students, how many came from employees. So at a global level, a very high level, we can see the use of the app, how many people are using it, but not the details, not the personal details.
School starts on Monday. A lot of people have already gone on that site, right, to upload it.
Thousands of people have gone on, and so this morning, I think around 11 o'clock this morning, a series of emails and texts and what other ways, maybe social media. I know we just bombarded the students with, hey, we know that you registered for an in-person class. Classes start next week. You're not going to be able to enter the classroom unless you do the right thing and upload your vaccine information. So I expect that we're going to get thousands. We have, as of this morning, 18,000 students registered at Manoa, and that number is increasing every day. We may have the largest enrollment on the Manoa campus that we've had in perhaps 10 years or more. So amazing work by our folks in enrollment, in admissions, and our student success team. We're looking to them. They are the ones that are reminding all the students, go ahead and do this. Classes start on.
That's incredible, the enrollment.
Yeah, it's great news.
I know it's a combination of things, but probably some local kids might be staying home instead of going to the mainland.
Well, interestingly, and the president reported on this today at the Board of Regents meeting, we are significantly up in resident students, in non-resident students, in our WUI students, and in our international students. Every single type of student category is up, and that's great news. I think it's a testament to the programs and the faculty and staff that run those programs.
That's really wonderful to hear.
Yeah.
Okay, so another question regarding vaccine cards. So can vaccine cards or testing results reporting be automated for employee listings and sent to appropriate unit staff for verification of compliance?
I wonder if maybe Lee can take.
Okay. I'll ask the question again.
Okay.
So, can vaccine cards for testing results reporting be automated for employee listings and sent to appropriate unit staff for verification of compliance?
The unions, I think the administrators are still in discussion with all three unions regarding some of those details. And I think President Lassner this morning reported to the Board of Regents that UPA as well as HGA and UPW are working together so that there can ideally be a uniform procedure for all of the unions. So those details are still being worked on. But as Michael said earlier, privacy is really very important. And so everyone's taking great care to make sure that we can stay safe, but really protect everyone's privacy as well.
Yeah, I defer to Lee there because she is the one that is much more experienced than I am on handling health records. I think everything that that her group has done and advised, and everything that our IT department has done has really had one aim, a primary aim, to protect that personal information. So thank you, Lee.
And this is for either of you. Can units use any kind of door policy to have employees and visitors show proof of status, health check, and testing?
I think this also goes along with what Lee said. We are actively in discussion with our unions to work out the details of the implementation. And I don't, it's always tricky if you say something like that. I do not at all want to give the impression that there is in any way a disagreement about the importance of this and the importance of making sure that we have people on campus who are either vaccinated or tested negative. Our unions have been partners in all of this from the very start of the pandemic. It really is important for us to be on the same page and the details of the implementation, who gets to verify and how do you assure that protected information is indeed protected? What are the ramifications for not abiding by the requirements and all of those details?
This next question is for Lee. Is the university planning to increase social distancing to 6 feet versus 3 feet?
Yeah, that's a really good question. And we've been working on that since before May. And our policies are definitely reviewed by the Department of Health too. We've been working very, very closely with them to make sure that we're fully understanding the nuances and that we're, compliant with both state and federal policies. So at the moment it is still remaining at 3 feet. And we can do this in part because we're requiring 100% masking indoors. There's actually quite a lot of studies now that have shown that wearing masks all of the time, even in populations where there's a high amount of unvaccinated persons, or if you're in a close environment, wearing that mask all the time is the best predictor, and it's really not as much the distance. And so we feel comfortable that with 100% mask wearing, we'll be keeping people safe. But again, this is part of a multi-level approach. And so trying to achieve as high vaccination rates as possible is the primary goal, as well as 100% masking and this self-checking with Lumicite. And so just as a reminder, the Lumicite is both a screening for symptoms as well as a reminder question about exposures. Because it's, you can have no symptoms, but if you've been exposed, you shouldn't be coming either, right? And then you also have the vaccination or the testing. And so with that multi-layered approach, and again, just being really cautious and thoughtful in our gathering sizes and our events, that's how we're going to keep everyone safe. So no, we're going to keep it at 3 feet.
And this next question's for you, Michael. Has UH Manoa installed HEPA filters in air ducts to make indoor classes safer? Will windows in buildings be open to allow for better airflow?
That's a great question. For many of our faculty and our students and staff, it's been a long time since they were in their office. And I'm seeing it every time on campus. Somebody is coming back to an office for the first time. And so I know this is the kind of question on everybody's mind. First of all, I'm going to say the same thing that Lee has been saying, and probably Lee is going to say this 10 more times. The best thing you can do is wear a mask. So that's number one. The other thing is we have many classrooms and buildings where you can open windows. So we're going to encourage people to open windows. Having said that, it's we talk about a HEPA filter, highly efficient particulate arrestor. This is the technical term. That's a filter. Another approach to clearing the air of virus particles is to purify it by killing the virus rather than filtering it. So those are two approaches. The problem or the challenge with the HEPA filter is, by definition, that filter will restrict the flow of air through the system. And so, particularly in some buildings, you're reducing the circulation and the turnover. There are access problems, maintenance problems, frankly, in some buildings, tremendous cost challenges. So what our team has been doing since early last year, in many of our buildings, they have installed UV systems, ultraviolet light systems that kill the virus if there is any present in the air. Those systems do not at all restrict the free flow of air. So circulation stays strong, the virus is killed. So in all of our large air handling systems, right now, UV purifiers have been installed. We're going to keep looking at that. Our team has done an amazing job. Hats off to facilities, Vice President Gabea, her team, Blake Araki, his team have done an amazing job. Talking to those folks early this morning, I mentioned this question, and they said, if people have a question about their building, their teaching environment, just contact them. And they'll talk it over, they'll address it as they can.
So a lot of thought has gone into all the practices you folks have implemented.
Yes.
I know there's positives and negatives for various things, but I mean, it seems like you folks found what's best to keep everybody safe. And I guess, I mean, it's up to the faculty if they want to open the windows or not. I mean, we're in August right now. It's humid outside today too. So I mean, it's really up to them. Huh?
Yes, and actually, I know a lot of faculty who are planning to conduct their classes outside. The Manoa campus is a beautiful place. We also have outdoor environments that are tailor-made to hold small gatherings. Of course, people need to be safely distanced, but we have spaces that are protected from the rain and yet are still outside with that free circulation there. So I think we're going to see a lot of improvisation in that regard.
And here's another question for you. How many of the classrooms will be provided plexiglass barriers?
So we have classrooms that have already been equipped with plexiglass barriers at the request of instructors, department chairs, and so on. So when asked, we have helped those departments to do that. We can pay for that kind of equipment using our federal funds. But then I hear the other side. There are many faculty who walk into an environment with the barrier and say, I don't want that. I want to be able to walk around the classroom and interact with the students. And so I think that a lot of that is going to be highly variable. But the bottom line is, whether it's in an office environment where staff want to have a barrier or in front of a classroom, we can make it happen.
Maybe Lee, if you want to weigh in, you being a medical doctor and just your thoughts on plexiglass barriers? And are they effective? Are they needed?
Yeah, that's a great question. There's been a lot of studies. They serve as a visual reminder about the importance of physical distancing. But wearing the mask is really the one that's the most important. If you are in an area where you're going to be exposed to a lot of fluids, coughing, sneezing, those kinds of things, definitely, makes some sense. But again, here we're trying to tell people to stay home if you're sick and wear a mask all the time. So, but there has been, variable data on the real life, data. So undoubtedly, they are helpful in certain circumstances, but wearing the mask is the most important.
Thank you. Michael, this next question for you. Will we be provided hand sanitizer and Clorox wipes to give to our students in the classroom?
Well, there's hand sanitizer everywhere on campus, and I do mean everywhere. So I have no concern at all regarding that. Our custodial staff will be coming into all of the classrooms every day and doing a thorough cleaning and disinfection. So people should feel comfortable making use of those classrooms. And I think Lee might be able to say a few words about what we've learned. I don't think any of us any longer returns from the supermarket and wipes down with a Clorox wipe, the milk carton and the fruit, all the stuff we were doing back in the early days of the pandemic. That's not the way this virus is transmitted. So I think a lot of people have to kind of switch their thinking about surfaces and contact and all of that. So maybe Lee, you can speak to that.
Yeah, correct. There's been a lot more studies done in controlled environments where, like at Emory, for example, and other places where they have environments built to test out how are these things transmitted, and very detailed collection and air ducts, all of those kinds of things. And so there's a lot of good evidence now that it's really not the surface. Having said that, of course, that's why we clean up after ourselves, which is probably the most important thing. But yeah, it's really droplet, precautions. And so, so actually our guidance for the campus changed in March, at the same time that the guidance from the federal government. So OSHA, Occupational Safety and Health Administration, I think. So OSHA and CDC updated their guidance in March that said you do not need to do thorough deep cleaning and doing those sprays. And that regular cleaning was fine. And certainly in the high touch areas, so doorknobs, other things, those should be cleaned more frequently. And they have been throughout all the campuses. So.
It's good, not just for COVID, but just in general to
That's why we didn't have a flu season last year, because everyone was using hand sanitizer and masks. So again, just another reason, we're nervous. We've got this surge going on, and then there's flu season, and we hear reports on the mainland with the kids with the RSV virus or the respiratory syncytial virus, and so it's this really double whammy. This is why the pediatric ICUs are full in some of the mainland areas. So wearing the mask is really important.
This other question is for you, Lee. For those who are vaccinated for COVID-19, should they consider getting a booster shot? And I know it's not just, students and faculty interested in this question. My parents are interested in that answer as well.
Sure. So one thing that I want to just clarify, because it is certainly confusing, is what was announced last week actually was an additional dose for immunocompromised persons. And these are moderately to severe immunocompromised persons, patients that actively have cancer or chemotherapy, or they're an organ transplant recipient or other things. So that's an additional dose. Those folks are thought now to not have made a good response to the vaccine. And so they are the group that is currently eligible for an additional dose. I know we still say booster, but it's not. Booster is the term that is reserved for those who are felt to have had a good immune response, which is everybody else, but for whom that immunity or the level of antibodies are now kind of just dropping. And so what is being discussed and what will be, I know the federal government, they came out with a statement and whatnot, but it still has to be approved by the FDA and the CDC, is for those people who got the shots first, And they're balancing it based on who's going to be the highest risk of getting severely ill or dying, i.e. people in long-term care facilities, older individuals, or people who are in congregate settings like prisons, and so these are both the prisoners as well as the staff, or folks like me who are health providers, where we are exposed a lot and can also give it to patients, and we certainly don't want to do that. So that will likely be the first group that will be eligible. And they're still evaluating the data on the other populations, but that group pretty much got their vaccinations in January and February, and it's looking like about 6 to 7 months is when it starts to drop, and so that's why the recommendation that's been in the past is about 8 months. So you can definitely, I think the other thing is to have the discussion with your physician, and the details of implementation are still being worked on, but we're waiting FDA and CDC approval first, and then there'll be more information in September.
Thanks for explaining the difference between booster and additional
dose. Yeah.
Okay, so Michael, this is a question regarding teleworking. So for offices that have functioned well with little or even no physical presence on campus, what is the minimum number of staff expected on campus, or is it entirely up to the managers and supervisors?
Yeah, that's a great question. I think the answer kind of mirrors what we've done in our working with our faculty in providing instruction to the students. We have never mandated to the faculty how they should teach their course. So they are either teaching in person or online. Many are doing a combination of the two, hybrid. In the same way, we decided to leave it up to the supervisors of our various offices to simply ensure that they can provide in-person services at a minimal level, meaning at a level that can keep up with the demand. That might be student-related services or might be employee-related services. In a sense, we are trusting our faculty and our staff to ensure that when a student or an employee needs help, needs service, that there will be somebody there for them. And I know some offices, well, I get the impression that most offices are, for the sake of providing that service, while at the same time reducing the density of people in their office, they're doing shifts. So maybe some come in the morning and others come in the afternoon, or some come in on Monday, Wednesday, Friday, and others come in on Tuesday, Thursday, and an alternate Friday. I'm hearing examples like that. We're trusting those offices and the supervisors to do their work in the way that can best provide the essential services that our students and our employees expect.
And we really do want to emphasize that this is such a fluid situation. I mean, gosh, things are constantly changing. We wouldn't have ever even guessed, that there was going to be the Delta variant. We seemed like we were on the path to normalcy, and then this happened. And so you folks are constantly looking at the situation, and changes are happening too, right? So people can expect that as well.
Yep, that's right. Yep.
Okay, so I do want to let you folks know that if you have a question, we are still accepting those questions. So email eforum, that's EFORUM at hawaii.edu, and make sure you use your hawaii.edu email account because we are limiting these questions to just faculty, staff, and students. Let's go to what we're calling a bit of a lightning round, just some quick questions, and either of you folks could weigh in. So what accommodations will be available on campus and in the classrooms for students who are unable to get vaccinated or fully vaccinated, and for medical reasons if they can't get vaccinated?
For the students who cannot get vaccinated, we're very mindful of the medical reasons that might be the case. We also have religious exemptions In both cases, the student must fill out a form. That form is reviewed. If it is approved, that student must undergo testing on a weekly basis. So that is the, in a sense, that is the accommodation. We are allowing those students to come to campus, but with the requirement that they undertake those weekly tests.
Where do they submit requests for an exemption?
We have our university health services. So as the president noted at the Board of Regents today, the University of Hawaii has long had an extensive list of required vaccinations for every single student that comes, and actually additional vaccinations for any first-year student that is residing in a residence hall on campus. So in a very real sense, we have added the COVID-19 vaccine to that list. And in the same way, exemptions, in particular medical exemptions, have often been top of mind and a concern, because there are real medical reasons that some students can't take certain vaccinations. So we want to honor that. And so that's why we have the testing option. There are certain classes that, in our estimation, ultimately cannot allow for exemptions, regardless of the reason for the exemption. And examples of those situations are music. If you have a choir of people singing, projecting their voice, and they cannot wear masks, it is very unsafe for an unvaccinated person to be there on both sides, for that person as well as everybody around that person. So we have required that in those situations, the department come to us and request approval. And I have to say that our chairs, our deans, the individual faculty have been very thoughtful in considering this, because it is a rather, or I should say, very restrictive measure. The only requests that we received over the last few weeks have been like that music example, very strongly warranted, I would say. And so we have, in those rather rare instances, approved the restriction of must be vaccinated without exception. I will also add that in every situation, I have sent those requests to Lee and her team, the health and wellness team, to take a quick look and review, and another set of eyes, that, and then they will come back to us. I will also add, finally, in every single instance, we have asked the department to make sure that that student can be accommodated in a different way. So obviously, if there is an online version, but usually there's not, by the nature of the work, that would be one route. A more obvious route would be a different course. Or in some situations, the department has decided to run the course an additional time in the spring. We all hope that we'll be in a different place in the spring. So
I know, for sure. Can't come soon enough. Here's another question. Are we allowed to require students to present their timestamp Lumicite UH message before entering the class? This is a question, obviously, from faculty.
Yeah, that is the entire reason that we have developed the Lumicite app. At first, it was at a system level, ensuring that any person coming to campus had self-assessed, and now we've added that ability to verify either a vaccination or a negative test. So the answer is yes. The simplest way for us to do this, again, while protecting protected information is to use that Lumicide app, and you just show the app and it's got a green all clear and you're okay. The faculty member doesn't even need to know, is this because of a negative test or is it because of a vaccination? In our health team's view, both are good, and that student should be allowed to enter the classroom.
This Lumicide app, is it, commonly being used at other universities? Is this a common app that you might know?
Queens Medical Center is using it, and I think others. Data House is the vendor that's been helping us with this really wonderful technology. But many schools are, if they don't have their own app developer and that capacity within the university, then they are using folks like Data House. But my understanding is that this app and this technology is being used not only in educational settings, but also in large venues, concerts, conferences, and other things. So it's pretty widespread, and Queens is using it as well. They have their own version, but so everyone who has privileges at Queens needs to do the app, including all of our students.
Good to know.
Yep.
And how we mentioned that this is a really fluid situation. So in the event that cases rise throughout the state of Hawaii, gosh, I really hope they don't. We're hitting some high numbers, but what's going to happen to the UH community and in-person classes should it keep rising?
Yeah, obviously that is top of mind. It's a concern. We all have the folks like Lee and I are on emails and phone calls every single day, tracking the changing situation around us and on campus. I have to say we are really encouraged by the high rates of vaccination among our students and our employees. And as Lee has said a few times, when you combine that with testing and with mask wearing, I think you could argue that this university campus will be the safest place on this island. I'm proud of all the work that has led to us being able to say that, honestly. Having said that, I think it's easy to forget that last year, even at the start and through the height of the pandemic, this university conducted in-person instruction in areas in which, in the faculty's view or in the unit's view, it was impossible to do otherwise. And so in Lee's school, the School of Medicine, the students need to be in the clinical environment. Our students and our faculty, in fact, were on the front line during the pandemic. They were also doing their other clinical environments, the practicums, our nursing students, public health and social work. We had chemistry labs and biology labs that cannot be replicated in an online environment, and in particular in those departments, you are teaching students who will go on to medical school, who need the hands-on knowledge, and so we continue. That's kind of there'll be a story written about that, I'm sure, the amount of instruction and the amount of research. We had for all intents and purposes, a record-breaking year for research. The only other higher year was in the year with the Obama stimulus package that gave universities a lot of research money. We didn't have that, and yet this past year, our faculty and students produced the highest level of research other than that one year in the history of the university during a pandemic. And so, do I worry about where this is going to go, this latest wave? Yes, I do. But I also have a great amount of confidence that the university will persist in our important work in support of Hawaii and in support of the students. Will continue.
Some challenges, but we all adapt, right?
Yeah.
As we've seen over the past year and a half. Okay, so another, let's say there is a mandate put in place, from the governor. What would be the available opportunities to students?
This might be a nuanced view, but I think it is important. When the governor instituted the first lockdown, the first emergency order, he designated the university as an essential business, if you will, but an essential activity. And so student learning and research were deemed essential. That's why we were able to do what I described earlier. I would have no reason to believe that anything would be different in a future such mandate, but I'll go back to what I just said. I am totally confident that we will be able to persist. We will be able to pivot those aspects of our work that we need to maybe pull back on. None of us wants to do that. We don't see a reason to do that right now, in particular, given the percentages of vaccination that we're seeing among students and employees. So we are, I think, it's a real balancing act, but I'm confident that we have the information, we have the approach that we need to do this safely.
And, we're going to actually take a quick 5-minute break. Thanks again for all of you who've submitted questions. And we do have another hour to go, so we'll see you folks back here at 3:05. Thanks.
happen. So I'll just see where I can do that.
Hi, folks. Welcome back to this live virtual forum. We have UH Manoa Provost Michael Bruno here with us today, and also Dr. Lee Buen Consejo Lam. She is the Associate Dean of the John A. Burns School of Medicine. And I'm Marcia Mane, your moderator for this. And we're here to talk about the fall semester, which starts already on Monday. And, thanks to those of you who submitted questions. And let's get back into those questions since we have so many to get through. So, Michael, here's a question for you. Should all courses be taught online at the start of the fall semester since Hawaii is experiencing its largest COVID-19 outbreak since the pandemic?
Now, the plan is to proceed as we are in terms of our instruction modalities. I believe that most people know this, but a majority of our classes in the fall semester are being offered online. As I said earlier, we are leaving the decision up to the faculty. We are not being prescriptive in how the faculty teach their courses. Over the last couple of weeks, we have indeed received requests from faculty to either move their course entirely online, or at our suggestion, many have changed their course from in-person to hybrid, which is a mix of online instruction and in-person. And in tandem with that, they have announced that the course will begin online. And then if conditions warrant, it'll move to a mix of in-person and online. So we've encouraged that as a good approach, in part because that ensures that faculty member and the students that they have a classroom reserved on the schedule at that hour. So when conditions warrant, they can go back to the classroom.
Have you gotten a lot of inquiries from the faculty to do this?
We've had a lot of conversations with department chairs and with their faculty. Believe it or not, we've had a surprising number of requests to go from online to in-person. And I think that might be because of faculty feeling more and more comfortable with the steps we've taken. In all of these cases, we have to make sure that the students can be accommodated. For example, if a student has enrolled in an online course, for all we know, that student could be living in California and is obviously unable to come to campus. We have rooms like the room we're in that are equipped as what we call here or there classroom environments. So the faculty member can be in front of students in the classroom and have active engagement with students who are not even in Hawaii.
If classes move online, do you folks increase the class size? Can more people join in, or you just keep the class size the same?
In this kind of situation, it's highly unlikely that you would enlarge the class because by now we've articulated the various sections, you've given the assignments of who's teaching what. That's not to say that there might be some shifting. There always is in the first couple of weeks of the semester. So yes, it's possible, but for the most part, things tend to stay as they are right now on schedule.
Just asking that in case somebody wasn't able to get into a class that they wanted and was perhaps hoping that they could get in.
Oh yeah, it's if a student is looking to change a class or add an additional class, absolutely, it would be far easier to get into a class if it's in an online.
This next question, how will the vax-unvax dynamic apply to campus activities, classroom size, and campus life?
There really will be no change. We have not in any way, other than those specialized classes that I mentioned earlier, like music. If you're on campus, you are either vaccinated or you're being tested. And in our view, it is safe for you to be on campus, both for yourself and for others around you. And, that's a good jumping off point. As we came on, we were talking about this. I want to kind of settle some confusion, because our initial communication was about the FDA approval that is going to come on, and what happens before and after FDA approves at least one of the vaccines. So if I try to explain it as simply as I can, in this fall semester, there will essentially be two categories of students and employees: those who are vaccinated and those who are not. And for those who are not, if they wish to come to campus, they must be tested weekly. Once the FDA approves, things are going to change. And the change right now is planned for the spring, just because logistically it would be difficult to change on the fly once the semester starts. So our anticipation is next spring, there will be three categories of people: those who are vaccinated, those who are not vaccinated and have approved medical or religious exemptions. Those people will be allowed on campus with weekly testing. The third category would be those who are not vaccinated but do not have approved exemptions. Those individuals will not be allowed on campus at all, even with testing. So that would be the change.
And some people actually need to be on campus for certain classes. So that would definitely affect them.
That's right. That's right.
And which leads me to the next question. If my courses have no vaccination exemption, do I have any way around it if I need the courses to graduate?
The number one aim for our departments is to ensure that the student graduates on time and is able to pursue the career that student came here for us to equip them for. And so in all of our discussions with our faculty and our department chairs, we have all agreed that we need to do everything we can and anything we need to do in order to accommodate those students that need a course in order to fulfill the graduation requirement. I always believe where there is a will, there's a way. And sometimes it means receiving approval to substitute one course for another course. So it may require that. It may require offering a different modality. As I said earlier, moving that course to the spring if that student is going to graduate in May. But we have been working on an individual basis. I've worked with a few different faculty earlier this morning. We had this exact same conversation, and I've not encountered a single instance where the department had not already created an alternative, an accommodation. So I'm confident we'll be able to do that.
I'm going to ask Lee a question just regarding JobSum. How have you folks, changed gears or, accommodated for this COVID situation? I know a lot of the classes probably need to be in person.
Yeah, so we received early approval from our accrediting body, the LCME, to actually require vaccinations. And so the medical school has had vaccinations required for all medical students really since March. We made it a condition of admission. It's part of the health clearance. We're physicians, we're training physicians. We're going to be in healthcare facilities, and we knew that at some point, all of our health facilities were going to require vaccination. And so we wanted to make sure that we could keep our students in the clinical learning environment. You know, we did have to have about 6 weeks last spring between March 16th and May 4th, where we didn't have students in the clinical environment at all. And, you know, you really want to have your healthcare professionals trained in a clinical environment with real patients. And so, you know, we actually have not had anyone ask for an exemption because the medical exemption is extremely rare. It's in a very rare case. And again, it is really just so important for us to be very ethical and really responsible and making sure that we're not putting our patients, you know, at risk. So,
And especially the level, you know, of always the interaction
right.
with patients. Have the students at JABSOM, have they had to jump in to help for the shortage of medical professionals?
That's a good question. So early on last year, some of our students were involved with swabbing, especially with our houseless populations. Our students also helped with registering them for their temporary quarantine site and things like that. And we've had them all back in the clinical environment since May. And some of them have, yes, they absolutely have been. They're still students, so they're still well supervised, of course, but they've been taking care of people who are suspected of COVID. Unfortunately, now they're all getting lots of experience because our hospitals are pretty full. So, you know, they're still well supervised, they're still parts of the teams and whatnot, but COVID is going to be around. It's a really important disease that we have to learn how to care for, you know, prevent and care for. And so we're just really fortunate that our students are there and they're in their N95 masks and everything there, you know, and so our guidelines and rules really are aligned with our health systems because we have to.
Have you actually, I know that Michael was mentioning that, you know, they've seen more people enrolling. Have you folks seen that at JABSOM too? I mean, have more people been interested?
Yeah, that's a good question. I think nationwide, there was a little bit of an increase in applications. And for us, yeah, we did last year for the class that just entered in July. I don't have the exact number, but it was definitely more. I think we were up to 2,800 applications for 77 slots. And that is a lot for us. You know, I wish we had more slots to take them, but we've kept our, you know, enrollment steady at 77. But yeah, we did have more people applying, and we have had, you know, students that just see what's going on in their communities, and it's really proven as more of a motivation for them to help and to really reduce some of the health inequities that we're seeing. So it's definitely been a motivating factor, you know, just to be able to get out there and help with outreach and education and other things, even before they're, you know, in their clinical roles.
I'm sure they feel good about helping in their community since lots of them grew up here.
That's why they come here, so that they can go back to their communities.
Okay, so Michael, turning to you for this question. All of my classes for fall semester are remote. I will not be living in Hawaii. Will the campus fees be refunded? Will we be receiving a tuition discount or refund?
So first on the fees, and I think this is on our website, student fee website. We do have fees that will not, I repeat, not be assessed to students who are being purely taught online. And those fees include the student activity and program fees, the campus center fee, the student recreation fee, the student health fee, the student transportation fees, and the athletics fees. So those students will not be charged any of those fees. We will not be giving any sort of discount on tuition for students who are learning online. And that's for a number of reasons. First of all, contrary to what some might think, our costs actually increased to perform our instruction online. The cost did not go down. These are the same, mostly world-class researchers, instructors in the classroom. They're the same individuals. The only thing that changed is we needed to produce the technology including environments like we're in today, in order to enable advanced instruction online. And so for the university, the costs increased. We're fortunate that the federal government made funding available to assist us in that. The other thing I would say is the value of a degree from a world-class research university like Manoa does not diminish in any way. If you are taking some or this semester all of your classes online, a degree from Manoa still holds the same reputation. It still opens the doors to whether it's a job or a graduate school or whatever route you're taking. Our assessment is that you are still getting a very, very, I think, good deal on a Manoa education. And so no, there's no intent to in any way offer a discount in tuition.
Now, compared to some of the mainland schools, it's lower if you're here, if you're a resident. The resident tuition is quite lower than some mainland schools.
Oh no, our resident tuition is among the lowest in the United States. The primary pool of students who are not from here are from the so-called WUI states, and they pay 1.5 times the resident tuition, and even that is a tremendous bargain compared to other public universities, way bargain compared to private universities. So we're proud of that. We're proud of the fact that we've held tuition pretty much in check. Any tuition increase is pretty much in check for 3 years now, at least 5 years. Our affordability, the amount of debt that our students take on here is among the lowest in the country.
It's good to know, because when you graduate, you don't want a huge amount of debt, right? Okay, so this next question, in 2020, and when classes abruptly went online, a pass-fail option was available past the typical deadline. So is this still going to be available?
No, we are not. We are not going to be offering a campus, what I would say was a campus-wide option for students to select pass-fail. We do have courses that within a certain amount of time after the semester starts, a student can opt for a credit, no credit. So those are the situations where students still can choose that option, but our plan is not to offer that option campus-wide for every program, as we did in that first semester in the pandemic.
And this one, for the fall semester, can final exams be optional for students considering the current number of COVID cases?
So we will be going out with an announcement today that we will once again be waiving the requirement for a final exam. Manoa has always had a requirement for a final exam across all of our programs. And we have now, this is going to be the fourth semester in which we will waive the requirement. That is not the same as saying you shall not have a final exam. We are leaving it up to the instructor. Every course has expected learning outcomes, and we trust the faculty to assess whether those outcomes have been achieved. How the faculty member does that can include a final exam, or because of this waiver, does not necessarily have to include a final exam.
So the students would be graded on other things? I'm just thinking about when I went to college, it was
Yeah.
all about the final exam.
Yeah, and for me, I always thought that was unhealthy to encourage someone to try and cram and learn everything just before that final exam, or even to put all of the assessment in that 1, 2, or 3 hour period. Just seems to me to be grossly unfair to everybody. Now, some classes have regular quizzes. Some say if you achieve a certain score, you don't need to take the final. Others might substitute a paper, some type of independent research. And so, yeah, again, we trust the faculty to essentially prove or put the student in the situation of having to prove that they have achieved the learning objectives. I do want to emphasize that we have professional schools and other programs that are strongly accredited by national accrediting agencies. And those accrediting agencies do require, all of them, proof that students have achieved the essential learning objectives. So that's a really serious thing. We have Lee here, of course, medicine, nursing, engineering, architecture, business, and I could go on and on. And we have many, many dozens of academic programs at Manoa that are strongly accredited. And so I know that the faculty take that into consideration when they think about their assessment and how they may or may not use final exams. But we are once again going to give the faculty that discretion.
Lee, does that, in JABSOM, do you folks run into that issue as well regarding final exams? What are some of the concerns coming from the faculty at JABSOM?
Yeah, so JASA's curriculum has always had multiple ways to assess student learning and achievement of outcomes. And we're actually required to be very transparent with our students in terms of what percent of what things, count. But there are final assessment, there are final exams, and there are also what we call formative exams given, in the middle of a course so that the student can have the opportunity to check and see how they're doing. And so those are still required. And it's one of many ways, for clinical skills, it's an actual clinical skills exam and those kinds of things. So there's multiple ways that we assess students. There's so many things that we have to check. So, but for some of the knowledge, it definitely is a final exam that has never changed, even throughout the pandemic in 18 months.
And back to you, Michael. So if classes go online, will the drop date be extended past the current deadline in order to provide the accommodations students who are unable to learn online?
Well, I think I can answer again. We have no plan. We have no plan to move all of our instruction to online. There is no plan to do that. That's not to say that we are unable to pivot to online. We did that successfully back in March of last year, and finished out the semester fully online, except for some of the classes I mentioned earlier. So again, I have full confidence in our faculty and staff and our students that if it comes to that, we can pivot, but there's no plan to do that at this moment.
And it is sort of a follow-up question. So regarding the financial policy change, why do only major requirements now count towards the 12? I am also working towards earning a certificate, but now I do not seem to have the funding for this.
Yeah, this is something that has always been a rule, but I think has not always been, let's say, enforced fully. So the U.S. Department of Education, when it comes to assessing student aid, federal student aid, that is Pell Grants, work study, student loans, the definition of a full-time student is 12 credits. There is an additional layer to that definition, that those 12 credits must be applicable towards that student's degree. Yeah. And so in other words, if a student is taking 15 credits and only 6 go towards the degree and the other 9 are in some other areas, that's a problem for being eligible for federal financial aid. Having said that, I can tell you that many of our students, I think the majority of our students, are taking more than 12 credits. And by the way, their tuition doesn't change. If they want to take 25 credits, it's still the same tuition. And we have students who, on commencement day, you know, when their degree is announced, it's 2 bachelor's degrees, it's a bachelor's degree and 2 minors, it's a bachelor's and a master's degree. So all that to say that the vast majority of our students are taking more than 12 credits. What we need the students to understand is at least 12 credits needs to be directly applicable to the degree.
Well, it's a better bang for your buck if you take more courses, but then you also have to handle them too, right? And then juggling a lot of courses can be quite difficult. So this is a question from a Neighbor Island resident asking if UH Manoa is going to continue to provide online access to most courses even after the pandemic, because I think some people really like the online learning, and also mean, you know, you might have some stay-at-home parents or who have to take care of their kids, and maybe they prefer not driving into town, or even, you know, the traffic situation sometimes it's actually better for some people in their situations to do online learning. So is that going to continue even after the pandemic?
Yes, it will. This is one lesson learned during the pandemic that I believe will be with us forever. We have learned in a very meaningful way how important it is for students to have choices. And I've heard directly from many of them that they really appreciate having a mix of in-person, online. They really appreciate the flexibility that mixing those courses has for their schedule. So many of our students are working 1 or even 2 jobs. So many of our students are a primary caregiver at home. And that puts a lot of stress on their schedule, and having the ability to maybe be on campus only 1 or 2 days a week and to be online the rest of the time is an extraordinary help for those students and their families. And we really have learned that in an important way during the pandemic. I think that the faculty as well enjoy the option of having in-person and online. To your point earlier today, the online environment gives them the ability to reach more students. We know that we can reach students on Maui, on the Big Island, Hawaii, in other Pacific islands or Asia or on the continent. You know, we have so many of our programs that are ranked among the top in the world. And I just think that as we continue to grow the enrollment and to expand our ability to provide instruction online, I think doors are going to open for new students to come to us and for us to go to them. I think it's a significant silver lining to all of this.
It's interesting how the pandemic has kind of accelerated this process, which would have eventually happened thanks to technology, but it really sped things up. I mean, and it's not only in the universities, you know, restaurants, you can order online from many places, even, you know, stores do online grocery shopping and go to pick it up. So it's interesting what the pandemic has, I guess, forced many of us to do,
I
right?
agree.
Including with telehealth and telemedicine.
And what was that, Lee?
Telehealth and telemedicine, right? We've been working at this as a state for a really long time so that we can provide access to many of our patients who are homebound or elderly or transportation problems or in rural areas. And so this pandemic forced all of us to adopt telehealth and telemedicine much more widely, very quickly, but that's definitely here to stay.
Is that what some of the curriculum, I guess you're teaching some of the students, are you integrating that?
Yeah.
into?
Yes, so it's an important part of how we deliver healthcare now. And so actually, we have an interprofessional module between medicine and nursing and pharmacy and our athletic training program and social work and others to teach our students how to work together via telehealth to provide appropriate care, in certain situations. And then the medical school has a variety of ways that we're exposing our students and teaching our students telemedicine.
No, that's really great. My mother-in-law, she had some appointments. She lives on the North Shore, and it was really great for her to be able to use that to communicate with the doctor instead of having to drive all the way into town. So that's
Definitely has been a silver lining for sure.
And this next question is for you, Lee. I am immunocompromised. My doctor says I shouldn't enter any indoor space if unvaccinated people are present. Does the university have any recommendations for this?
Good question. And I certainly understand, the concern. So, wearing the mask is very important. And as I mentioned, there are definitely better masks than others. And so, having something that has multiple layers of fabric and the filters is really important. If an immunized compromised person wants to also wear eye protection to be extra safe, that's certainly, the way that we keep ourselves safe in the hospital. The other thing I think is to speak with their supervisor or with their instructor in terms of spacing, right? So if you're an employee, see if you can be perhaps moved to a room that's a single room, so you're not in a shared space. Or spaced out more than 6 feet from others. But certainly, every case is really different. And so we really encourage everyone to speak to their supervisor or their instructor or the Kukul program. And that's what the Kukul program is here for at Manoa.
And this next question is also for you. So is close contact considered a cumulative, not single exposure of 15 minutes over a 24-hour period, regardless if it's in an enclosed or outdoor environment?
Yes, it is. Close contact in a non-healthcare setting is indoors or outdoors. And even if you're wearing a mask, you're considered a close contact. And if you are vaccinated, you do not need to quarantine, but you should closely self-monitor for 14 days. If you are unvaccinated, you're quite high risk. And so so if you're notified that you've been exposed to a close contact, then you should immediately self-quarantine for 14 days. And even if you do get a test at day 3 to day 4, 5, day 3 to 5 now, even if the test is negative, you should still quarantine for that 14 days because you are unvaccinated.
Thank you. Michael, this next question is for you. So what if someone looks sick? What should we do? I'm sure this is a question from the faculty. What if a student comes in looking sick?
If it's a student, I would hope that the faculty member has the relationship where the faculty member can engage directly with the student. That would indicate that the student had not truthfully filled out the Lumicide app, because it clearly states there, do not come to campus if you are feeling ill. I'm going to expand that, though. This is not just students. This is faculty and staff. If you're feeling ill, stay home. And if someone in your office appears to be sick, if you don't have the working relationship where you can say, hey, you should go home, then I think you need to talk to the supervisor of the office. If worse comes to worse, we have the Whistleblower Program where a person can go online. If somebody reports a negative situation like that, those are read immediately and action will be taken. But, our hope is that because people have been taking the Lumicide daily check-in seriously, you can't fill that out and say, "Oh, I'm feeling really lousy today, but I think I'll go to campus." I just hope that that is not something that happens in this semester.
And hopefully not on final exam day or, where they feel like they need to be
Yeah, well,
in class.
I know that our faculty, let's just state it clearly, these would not be the first situations where a student has fallen seriously ill. I mean, this happens, I wouldn't say routinely, but it happens. And our faculty are very thoughtful and have experience, and understanding. So, you make an accommodation for a student who can't show up because of a serious illness.
Yeah, not only COVID, but
Not
other
that's right,
things as
not just
well.
COVID.
And this next question is someone in an on-campus office or classroom tests positive. What is the protocol to inform everyone that may have come into contact with them?
Well, we follow CDC and Hawaii Department of Health guidance. And right now, what happens is that any person who has been exposed to the individual who tests positive is notified and is advised to self-assess if they have symptoms and to isolate if necessary. Now, the team, our COVID response team, would have that discussion, and it would usually begin with, "Have you been vaccinated?" Because then the protocols are different. Regardless, the space is immediately closed for 72 hours. A sign is placed on the space saying "No entry," and the space is clean. So that has been our protocol, and that protocol can be viewed on the COVID-19 website. We have also been announcing to the campus, in general terms, there was a positive. We're just trying to be transparent about that while balancing the individual's privacy and protected information. So I know that there's been some, let's say, dissatisfaction. Why can't you tell us more information? As I've tried to explain, if you are affected, you will know. If you haven't heard from us, don't worry about it. It's not in your building.
Same thing, the health department deals with this as well. They got, some people said, "Why can't you tell us which restaurant it happened at?" And there's some privacy issues there. And so if needed, they would say it, but if not, they didn't. And the same stories for you folks,
That's
right?
right.
Privacy
That's right.
issues. Okay, so if a student in my class gets COVID during the semester, what accommodations have to be made? Can I treat them like any sick student pre-COVID, or it's their responsibility to keep up, meet with me outside of class if they need extra help once they return to class?
I think, in a sense, whoever wrote that question answered their own question, and it's what we were just talking about. I would say to all of our faculty, you treat that student as you would any other student from any other year who has fallen seriously ill. And I must say, and I'll take my hat off not only to our faculty, but also the students through the last 12 plus months who have fallen sick and tested positive and had to go into isolation, which is not easy, particularly for an 18-year-old who is away from home for the very first time in their life. It's not easy to be isolated. And I think our faculty know that. And I know that in those usually 2 weeks of isolation, the faculty have worked with those students to make sure their learning continued. And again, I think the students themselves have been courageous throughout. And I'm hoping that almost all of them that can, are vaccinated, and they won't have to go through that. You know,
I know people view COVID as being different, and it is different in many ways, but most businesses have policies and protocols in place should somebody, including a customer, a hotel guest, come, get illness,
Yeah.
right? I mean, they already have some policies in place.
Yes.
And so it's kind of just adapting those existing policies.
Yep.
Okay, so Lee, this next question is for you. If my child's preschool is closed due to a high number of COVID cases, am I considered a direct contact? Basically, they want to know if they have to stay home.
Right, so that's a good question, and unfortunately one that I think will be common, for our students with children as well as our employees with children. So the first thing I want to say is that because we have so many COVID positive cases in the community, we're going to see more COVID positive cases, right? And especially in the unvaccinated. And children under 12 currently are not able to be vaccinated. And so yes, even with all the best mask wearing precautions in place and all of the great safety restrictions our schools are doing, inevitably they're going to get sick. And what we're knowing, in fact, the cluster report from the Department of Health just came out today, these folks are getting sick at home, and they're getting sick in family gatherings or social gatherings. They're getting sick at weddings and bars and other places where masks were not worn, where there was no physical distancing. And so they're bringing it home, infecting the children, infecting the other children, and then therefore that's what happens, right, with the preschool. So, and so with a close contact, it means someone who is within, 6 feet of a positive person for 15 minutes or more cumulatively over 24 hours. So in the preschool setting, it's, they're in close contact for more than 15 minutes. But again, you're going to be a close contact. And so if your child was not in that class, and so what happens with notification is that the person who is determined to be a close contact, so maybe that entire classroom, would be notified, the parents would be notified. And if it is really the whole classroom, then yeah, the chances are likely they would keep the whole school home. If your child is not in that classroom, they're not really considered a close contact necessarily, right? But they're keeping everyone home to keep them safe. And if your child is not positive, then the parent is not necessarily at the same risk, right? It's what we call the secondary exposure. And so that's one level of risk. So the first thing is your child an actual close contact? And then the next one is your child testing positive? Because if your child is testing positive, then you, the parent, would absolutely be considered a close household contact. And the next question is you, as a parent, are you vaccinated or not? And because if you are vaccinated, then technically you do not need to quarantine. You self-monitor your symptoms for 14 days, do your Lumicite checking, all the rest of the things. And there is a recommendation now to get tested, even for fully vaccinated, to get tested at 3 to 5 days afterwards, just to be safe. But you don't have to quarantine for the COVID. If you have childcare issues, that's a different issue. If you're unvaccinated, you need to isolate and isolate with your child. And that means strictly the only time you're going to go out is for medical care, maybe to get another test, but you need to stay put. And, have people deliver groceries and leave them outside your door. I mean, very strict isolation. That's the only way we're going to contain this. And so that's really the decision points. Is one is if your child is positive or not, then are you vaccinated or not? Now, if people do have child care challenges, though, as we know that many did and may continue to do, then that's when you have to have the discussion with your supervisor or with your instructor. And as Michael has been saying, there's a lot of options continuing for online education. When you need to be online as well as online work. So.
This applies to so many different people and not just those with kids, but just in any setting.
Right. I mean, we have a lot of folks with their parents at home or, something. And so it can be confusing, this whole distinction between quarantine versus isolation. But isolation is very, very strict. And that's for if you are positive, you need to isolate. And, and we've had cases like that. So, but quarantine means also pretty much staying put, as well. Yeah.
And these next questions came in during the forum. So thanks again to those of you folks who have submitted questions. So the first one is, do employees get leave for getting tested? Will it be counted as work time, sick leave, or vacation?
No, we will not be granting leave for employees to be tested. We are granting leave for employees to get vaccinated. And so it's their choice. If they want to enter into the weekly testing program, they have to do that testing on their own time. And I make no apologies for that. That's just the way it's going to happen.
And this next question regarding the Lumicide app, it asks for a campus location, but what if our project is off campus? Should we still select Manoa?
Yes, if you're an employee or a student at Manoa and you are engaged in an activity under the auspices of Manoa, you click on Manoa. Ultimately, it's not the physical place we're trying to protect. It's not the campus, the trees, it's the people. So you are presumably with other Manoa individuals and with the community, and we want you all to stay safe. So go ahead and click on Manoa and do the self-assessment, and you're all good.
This next question is also about Lumicide. I am fully vaccinated, but feel uncomfortable uploading my information to Lumicide. Can I show someone my vaccination card every day instead of using the app?
So what we are trying to do is provide the information that makes all of us confident that we're going to be safe, working together and learning together. And we're trying to do that in a way that protects your privacy and your protected health information. The app was designed by the University of Hawaii in partnership with a private entity, Data House, and only authorized individuals from the University of Hawaii and Data House have access to any of the information. And it's all subject to privacy policies. Your information will not ever be shared for commercial or, for that matter, any other purpose. People need to be confident in that, and we're going to ensure folks that that will be the case throughout this period. Ultimately, the Lumicide app is a really easy way to self-assess. You're all good to go that day before coming to campus, and to inform those around you that you're either fully vaccinated or you've had a negative COVID test. And you can do that while ensuring your privacy.
Ms. Lee had mentioned even the Queens Medical Center is using it. So I mean, other big companies and even Queens is using it. So you should, that should give you some sense. So
yeah, I think
he
so.
said it'll be okay.
Yeah, it's really designed to be very, very, very secure, but certainly understand, the hesitancy with all that we hear about, identity theft and other things. So certainly understand where that comes from. It's really tightly regulated, and the other reason that we really do hope that people will upload it to Lumicide is, again, there's a lot of back-end verification to make sure that it's accurate, right? But as to the good question about, can I show a paper card? We know that not all of our students and not all of our staff may have access to a smartphone, right, for a variety of reasons. And so remember that Lumicide is not only the vaccination card, right? And so certainly that could be, the physical card can be shown. But for folks that don't have their a smartphone, or maybe they don't have it that day, then we're also working on a paper version, because we need to make sure that there's a process to do that screening for symptoms. Just like when you go to the hospital or any healthcare facilities, right? You get that phone call a day in advance, and when you're at the door, you get asked, have you had contact or some exposure? Have you traveled anywhere in 2 weeks? Do you have any of these symptoms? So those will be done on paper, so that we can still have all of the protections in place. But we really do encourage folks, if they have a smartphone and a device, we really do encourage them to use it.
And boy, where'd the time go? It's almost 4 o'clock. So, that's all the time we have for questions. But if we didn't get to yours, please email covid19@hawaii.edu, and the UH Communications team will help you out. And before we go, just some closing remarks from both of you, maybe a message to the faculty and staff and students.
Well, first of all, I want to say brava, Marissa. Thank you so much for your help today. This has been a really good and important event for us. So thank you. And to everybody watching and everybody who will eventually watch the recorded version of this, stay safe and healthy, and be excited for the start of another semester. We're all looking forward to seeing you on campus. Go Bows.
Yes.
And I actually do have a closing question, not to end on a somber note, but just to really give a dose of reality. We really are experiencing an unprecedented, very disastrous surge of COVID throughout the states. We need all of our healthcare systems, whether it's the hospitals or federally qualified community health centers. We need everyone to be able to care for everyone in Hawaii, whether they're sick from COVID, trauma, stroke, heart attacks, cancers, or other problems. Right now, our health systems are really, really stretched. And we have seen a headline today, right? Straub's ICUs are full. We've seen what's going on in the Big Island. And so it's really, really imperative for all of us to do our part. We really are all in this together. This surge is different. This variant is very aggressive. It sticks to your nose better and replicates better, 1,000 times more than the original variant. And we really need everyone to do what they can to prevent this, which means get vaccinated. We need everyone to wear their mask when they're indoors, and when you're outdoors in a crowd. We need everyone to maintain physical distancing as much as possible. Please stay home if you're sick. That's how we're going to keep the state safe. That's how we're going to keep the campus safe. That's how we're going to keep healthcare open for those that need healthcare besides for COVID. And so please really just begging everyone to let's be in this together. Let's truly act with aloha and as one big ohana so that we can keep each other safe and get through this. We don't know when the surge is going to end. We're hoping that it will end soon, but it is going to be a terrible next 4 weeks. So we're really asking for everyone's help and thanking really all of this. There's a huge number of folks here across the system. We've been working really hard for the last 18 months. And so I want to thank all of them too.
What a great way to end this forum. Thank you so much, Dr. Lee Buen Consejo Lum, Associate Dean of JABSOM, and UH Manoa Provost Michael Bruno. Thank you so much. And, thanks to the UH Communications team for putting this on. And, really thanks to all of you for your questions, such great questions. Hopefully this will be a great fall semester. Starts on Monday. Enjoy your holiday weekend and stay safe. Bye.
Aloha.